As healthcare is getting more expensive and as services are getting more expensive, we have to figure out what it is that we're doing that actually works and focus there.
As researchers, we often design studies to answer questions and get answers that then we think are going to make the difference. And I think if we want to make a difference, we have to think about those larger, all those layers and those contexts that we can then adapt and apply that evidence or that information. And so I think understanding the epidemiology of what's happening in a city or in a province or in a region or a state, knowing that, where are people living and, who those people are, what access to service that they have or don't have. And then there's our interventions or the work that we're finding out that makes a difference. So it isn't just having a finding and saying we can just go to a community and say, here's the magic bullet or here's the magic, this is evidence that if you just applied it, it'll make a difference. It's then working with the people in their community, with the systems and understanding how you train and have fidelity to that intervention or those approaches or that program, and how you work then across these programs and people to make it happen, right? So these changes take time, they take resources, and at times maybe there's no new resources or there's constraints. You have to decide, well, if we're going to implement this, what do we then take away, and how do we do that? If something then is tried out in one place, it may work in one and not another. If we try it on another place and it doesn't work, then we should pull back and try something else. So program science is about taking the evidence, working with the people in their contexts, with those program people, with policy decision makers and researchers and community people that are affected all together. And I think that's what's exciting about it, is because we're all in it together and we're all going to figure out how to make it work. If one of those pieces and those groups and those isn't working well with the others, then it's never going to, it may not work as effectively or as efficiently. And so I think this is about a new approach. It's about new thinking, and it's about working together in a way where we all want to be around the table, shoulder to shoulder. We want to level the playing field and recognize that everybody's voice matters, that the lived experience in this context matters, and how do we think about, really the end game of this in a way that we're going to take that evidence and make it work in a very pragmatic way to make a difference to an individual in their community.
For a service provider or service organization, I think there are two good points in time to think about mathematical modeling or economic evaluation. And one is, we've implemented a program. Now I want to see, what has it done? I'm already past the point of trying to design a study or design an evaluation. I want to see what's happened so far because of what we've already done, and think about what the next step might be. I've only got so much funding in order to do that. So that's a good place, because then what mathematical modelers can help with is say, this is what we think the impact was probably. And if you're going forward, these are what we might be able to expect. The second point in time is actually just when you're starting anything new. So anytime we're starting anything new, to ask ourselves, if we want other people to do what we're doing, we want it to be translatable to other contexts. That's a great place to involve mathematical modelers, because we can try and look at, or we can collaborate and look together to see how what you're doing has an impact not only in this particular context, in this city, or in this subgroup or population, but if we were going to try it somewhere else, in another city, what might we have to change? So I would say those are two good points in time.
There's a lot of fear that if a programming or implementing partner has received a huge sum of money to implement a particular program, that for them at the end of that program to say, listen, we did this really well, but in the end it didn't work in the way that we had wanted it to work. And for them to be honest around that and to be able to be honest around that without running the risk of that money going to somebody else in the future is something that has to happen at the level of the programmer, but it also has to happen at the level of the funder. So the funder, needs to understand that there's different ways that we can evaluate impact. So there's sort of the financial accountability piece of process indicators, for example. We can actually track how many condoms we distributed, how many units of housing we provided, how many peer educators we trained and were set out to educate their peers. And so we can see that actually the money was well spent, but we can also measure impact indicators and say, did HIV testing increase during this time? Did HIV prevalence stabilize? Did more people living with HIV get access to treatment? And ultimately, did viral load come down? And if those aren't, then if those outcomes, and we're not seeing that impact, then it's at that point we need to diagnose what it is that happened. And that really is where program and implementation science fit in, because it allows you to diagnose, is the intervention actually not the right intervention? Or did you not intervene right? Did you not, did the peer educators not meet long enough? Did they not use the right curriculum? Did they not have dedicated support in order to do these things? Was it as simple as they needed, access to, public transit, or they needed cell phone coverage in order to be able to phone people to do follow-up, and we didn't give it, and thus the whole program failed? And so I think it's advantageous to, most people involved to really ask these nuanced questions so that we can really diagnose if a program doesn't work, we can answer that question, or at least work towards answering the question of why it didn't work. And I think it's equally important to answer the question of why something works, because then again, it gets into that issue of let's focus in on just the components that work the best. Because, the sort of right answer of a mix of programming is to do the least, but to achieve the outcome that you want to achieve.
If we think about interventions or program, if we think about anything that could lead to a change, oftentimes we say, well, if we did it or didn't do it, what would be the consequence of that, or what would be the impact of that? But oftentimes we're not dealing with do or don't do. We're dealing with choices, do A or B or C or D. And that's where if you do A, maybe you have the largest impact. If you do B, maybe a little bit less, C, maybe a little bit less. And so you sort of get this proportional or gradated impact. But then you add on other bits like, well, but maybe it'll cost me more to do A, even though it could have the most impact. So then when I use that as a ratio, that comes down and maybe B goes up, because for same impact, maybe it'll cost less. And so I think when we're looking at different options, it's about thinking about what I can get for what I need to put in. And importantly, it's not just what I put in, but if I do B, I may not be able to do A or C or D. So we consider that an opportunity cost. I have to forego doing something else in order to do B. And so those are the three factors we sort of put in to that to come up with this stepped approach to what we can do.
It also feels like we're going to ultimately sort of adversely affect the population that they aim to serve. And I think what we're seeing now, and there are some examples out there. So there are certain ways that peer education programs, for example, are implemented that haven't really taken into account the sorts of risks that people actually have. So, for example, just providing peer education without, or sexual health education programming without talking about the real things that people face, including sex work, compensated sex, sexual violence, gender-based violence, the need for testing, for treatment for those living with HIV, access to things like pre-exposure prophylaxis, that if you're relying on a really old educational curriculum, a common one being sort of college students educating people around abstinence program or anything, that it's actually that's probably the most evidence way of taking it away is to do the same sort of study design that you would do where you're testing an intervention, except here you're removing it. So you could randomize a group of people to not get the intervention compared to people who do get the intervention and see if there's any differences in their outcomes. You can randomize entire hospitals, entire clinics, entire communities to doing that. And I think that's sort of a move, and it's a challenge. It's a challenge to get funded because you're putting in a study design where you want to test doing less and or test doing nothing. And there's that I think that there's sort of this. The concept is anathema to most, but I think it is really an emerging domain, an important one for us moving forward.
The way we do science is not in the ivory towers. We're out in the community working with the people on the ground at the front lines. And I think it is about engaging the people that we need, but also those who may be on the margins or on the periphery, and engaging other service providers, clinicians and social workers and educators and people with lived experience and so on. Like, everybody has a role. And the more, and I do think that it is about that energy and the interactions of the people that are going to make the social context to make a difference, right? So if there's a new service provider, that wants to contribute, let's find a way to bring them in and have them part of this process, because we don't have that's how it's going to work. It's people with energy, with enthusiasm, with ideas about how to make a difference. And a lot of this work is about getting service providers and frontline people who have made it work on the ground for a long time to bring their ideas and their thinking and their ways of managing that complexity in the context of the scientists and the policymakers. You bring all those people together in those spheres, you got a recipe for some really exciting opportunities to, with the best minds, to think about solutions that are going to really make a difference.